That's all the sports. Thank you, Mugire, for that. Let's take a look at other stories making headlines. Human papilloma virus, or HPV, is a significant public health concern in Kenya. Being the leading cause of cervical cancer in 2019, the government introduced a free HPV vaccination program for girls aged 10 to 14. However, uptake remains low. But there is a new alternative in a self-testing kit launched by an international pharmaceutical company. Here is more on this by KTN's Chebet Birir.
Cervical cancer remains one of the biggest health threats globally. According to Globocan 2020 data, it contributes to more than 5,000 new cases and more than 3,000 deaths annually here in Kenya.
Cervical cancer can be prevented. No woman needs to get it at all in the world today. And if detected early, it can be cured, which is a rare word when you're talking about cancer. So here we have a cancer where we have opportunity, we have tools to be able to eliminate it from the world. And the challenge that we have today is a challenge of access. Many women are not empowered with information about their risk for cervical cancer.
The national HPV vaccination program targeting girls aged 10 to 14 that was launched in Kenya in 2019 continues facing low uptake. In 2020, only 33% of the targeted population received the first dose and 16% returned for the second dose.
Governments don't have a prescribed, in terms of a policy environment, a prescribed screening test that is standardized and scaled. And so what happens tends to be patchy.
However, there is hope. And it lies in innovative solutions like HPV DNA self-testing, which is changing the landscape of cervical cancer screening. Unlike previously, when some women would feel uncomfortable and stigmatized with pap smear, the new approach allows them to collect their own samples in the privacy of their homes.
And it also frees up healthcare workers who will otherwise be spending a lot more time doing sample collection to focus on other elements.
No more anxiety over clinic visits, long waits, or the fear of being examined by a doctor. Over the last 5 years, there have been significant gains in combating HPV in the country. However, limited access to health facilities and information on diagnosis and treatment, cultural beliefs and social norms have influenced HPV testing and vaccine acceptance.
There are cultures that will not allow a male health worker to do the sample collection from a lady, and in those cultures, self-testing becomes very important to increase the number of women that opt in for cervical cancer screening.
The COVID-19 pandemic also disrupted immunization programs, including HPV immunization. However, the lessons learned continue to inspire new ideas, including the self-testing kits. Chebet Birir, KTN, Nairobi.
Over the years, Kenya's sexual and reproductive health and rights has been faced with many challenges.